Okay, so we have three speakers across the globe. Our first is Dr. Andrea Ramirez Varela. She's an assistant professor and physician scientist in the Department of Epidemiology at McGovern Medical School Department of Pediatrics. Dr. Ramirez Varela works at the intersection of public health, physical activity, and epidemiology in health policy research. Her research interests include epidemiology, public health surveillance, health policy research, preventative medicine, and global health public capacity for disease prevention, especially in Latin America. She currently serves as the co-chair for the Global Observatory for Physical Activity and the Global Observatory for Physical Education, which we'll hear more about in today's presentation. Our second presenter from Portugal, Dr. João Martins, holds a doctorate in education sciences from the Faculty of Human Kinetics at the University of Lisbon, Portugal. He also earned a bachelor's degree in sports sciences and a master's degree in physical education from the University of Lisbon, as well as a master's degree in epidemiology from the Faculty of Medicine at the University of Lisbon. He is an associate professor at this university and a researcher at the Institute of Education at the University of Lisbon. Dr. Martins coordinates the Global Observatory for Physical Education. He's the vice president of the Portuguese Society of Physical Education and a member of the International Association for Physical Education in Higher Education Board of Directors. His research interests include physical education, physical literacy, physical activity, health, and promoting active lifestyles. Our final speaker, Dr. Danilo Silva, is from Brazil and holds a doctorate in physical education from the State University of Londrina. He is a full professor in the Department of Physical Education at the Federal University of Sergipe. He coordinates the Center for Research in Health, Physical Activity, and Sport, also known as SAFE, and the South American Physical Activity and Sedentary Behavior Network. He is one of the Brazilian representatives of the Global Observatory for Physical Education. He is a member of the Brazilian Network for the Measurement of Physical Activity and Sedentary Behavior, the Spanish Network for an Active and Healthy Childhood, and serves as the first secretary of the current administration of the Brazilian Society of Physical Activity and Health from 2024 to 2026. He's a senior associate editor of the Journal of Physical Activity and Health. His research focuses primarily on behavioral epidemiology, health policies, and interventions aimed at promoting physical activity and reducing sedentary behavior. Without further ado, I'll turn it over to our speakers.
Thank you so much, Wes. Good evening, everyone. Good morning. Good afternoon, everyone. So we're really pleased to be here today, and I want to thank, in particular, Srila, Heidi, Wes, and all the Health Equity Collective members for this opportunity to present our work and to provide some insights in relation to physical activity promotion in children and adolescents. So I'm going to provide like a brief overview of the session that you're going to see today. So in the context of Senate Bill 25 and thinking about how to promote physical activity in the school settings and through physical education, we put together this presentation. And what you will see is from my part, like an introduction of the problem. Then Danilo will present some examples that are similar to with the similar structure of the United States and where we can have some lessons learned and some policy ideas. And then João will wrap everything up, presenting some key ideas in relation to implementation opportunities and challenges and how can we move forward the field of research in physical education and physical activity here in Texas. So for us, it is a true pleasure to present to you this work, and please ask as many questions as you need. So to start with some general ideas, we know that physical inactivity is a pandemic, and it is a pandemic because it is a risk factor with a greater occurrence than expected. Therefore, we say that it has a high prevalence, and it has a high prevalence because we know that 30% of adults do not meet the physical activity recommendations, but even worse, at least 80% of the adolescents and children do not meet the physical activity recommendations. It also crosses international borders. Therefore, it has true global reach. And if you see here in this slide, you see that it is critical in so many countries where we have physical inactivity prevalences over 40 or 50% even, and this is only for adults. And for kids, it's even more complicated scenario, because you see, for example, here on the left, the prevalence of insufficient physical activity for boys from 11 to 17 years old is really high. Even up to 75% of these kids do not meet the physical activity recommendations. And if you look at colors green, light green, yellow, and red, it means that it is highly prevalent. And you can see here most of the countries of the world being affected by it. And with the girls, is the same problem, and girls are even more inactive than boys. And also, we know that it is a pandemic because it has a high burden of disease. Therefore, the health effects are really prominent. And in the 10 years ago, in a Lancet series, the first Lancet series that was published about physical activity, Aimin Lee, who is a physical activity epidemiologist from Harvard University, estimated that physical inactivity had as many deaths as per year as smoking. So it is a risk factor for health, and we know that at least 5 million deaths could be prevented every year if we increased physical activity in the population, not even to mention the high costs for the healthcare system. As I was mentioning, also, there is plenty of evidence for the last 50 years showing the direct association of physical inactivity as an independent risk factor for coronary heart disease, type 2 diabetes, breast and colon cancer, premature deaths, and now even with dementia and some cognitive decline. Therefore, and this is for adults, and we will see, and João will explain this, that there are some true effects in relation to the health of children and adolescents. Also, the CDC reported that 9 to 11% of deaths of healthcare expenditures in the United States were because the adults were not meeting the recommendation of physical activity. So in summary, there was a paper that was published last year about the trends and patterns of physical activity guidelines being met by the countries and the objectives. And what we know, unfortunately, is that most of the countries are off the track. So it is, what does this mean? This means that most of the countries will not meet the global target to reduce physical activity by 15% by 2030. Therefore, this is a really good moment to think about it and think about scaling up effective interventions and really tackling macro and distal determinants that can really change the population physical activity prevalence estimates and the practice. So in relation to that, obviously, you have seen this. This is an ecological conceptual model of the determinants and correlates of physical activity. So you have here multiple levels. The first one is the individual level, then you have the interpersonal environment, and then national and global levels. And the work we do in the Global Observatory for Physical Activity and Education is related to these macro level determinants, which are policies at the national or global level. So these ecological models highlight the importance of policies in relation to physical activity and physical education, because they do determine physical activity and physical education practice or adoption in the population. We know that as an upstream determinant, these policies play an important role because they contribute to system changes that make the environments more supportive and that enable environments so people can actually change their behavior. So this is why policy is critical for us, and this is why it's important to think about the impact of policy to change individual behavior. Also, we know that successful national physical activity and education policies have the true potential to influence health and well-being of the population. And here in the bottom, you see this triangle. And we know that obviously having changes at the national level, regional or global level, they are more complex, but they definitely have the potential for a greater impact across the larger population. So in relation to physical education policy actions, the International Society for Physical Activity and Health, informed by multiple collaborations with the World Health Organization, the Center for Disease Control and Prevention, and other supranational organizations determined that there were 8 investments that really worked for physical activity, and it means that there are 8 settings that have evidence of effectiveness to change prevalence of physical activity and the practice of physical activity in the population. The schools, not to be surprised, are one of these settings which are critical for this promotion to happen. Therefore, schools and whole of school programs were inserted in the call to action for countries to promote physical activity and to include it as part of their policies. We know that for school-based PA and for and the physical education that is promoted as part of all the strategies that can help to promote physical activity at the school level, we know that for example, here, there are multiple different strategies, but they are tied to all the evidence and the really strong evidence of the health effects for children and adolescents. I'm not going to read this, but just as like for adults, kids do benefit a lot from their cardiovascular health, metabolic health, brain health, musculoskeletal health, but not also their physiological functioning, but also academic achievement, performance, and also social development and for physical literacy and healthy lifestyles. So there's a lot of evidence that supports the importance of physical activity in childhood and during adolescence. And I just want to bring this up here and bring Professor Bill Cole, because he was one of the biggest supporters of physical activity and physical education during childhood and adolescence here in Texas and the University of Texas. So some of the policy actions, and I'm not going to go into a lot of detail here, but there are some actions, like when you think about the schools, and there are some areas, which are 9 policy areas that you can see here, that have very specific indicators that, in my opinion, are actions and areas of action that we can take advantage and we can use to develop different programs and interventions and research studies. So this was part of a systematic review that included studies that identify policy areas and policy actions that had evidence of effectiveness to promote physical activity in schools. So for example, in relation to physical education, you see that there are indicators showing like the benefits of having a minimum time for physical education at the school, having physical education in the curriculum, having a specialized human resource to be able to teach these skills, and some evaluation and assessment indicators as well. Therefore, there's evidence and evidence of effectiveness showing that it is critical to strengthen the provision of good quality physical education, and João will talk about this later on. Also, in relation to the whole school physical activity, we know that it's important to have a policy that regulates this. In relation to sports, this is one, and the extracurricular activities, we know that this is one really good opportunity to promote physical activity in other areas that are not inserted in the school routine. So once the school finishes. In relation to active breaks, there are some indicators that show that there should be like that there could be a structure and a minimum time of physical activity in the recess, and also, for example, breaks. And these others are more related to the built environment and how we can help kids to get to and from the school, and also enable the environment so they can actually participate in physical activity and structured physical activity, or even free play. So I'm not going to read them, but I just want to tie this up with surveillance. So surveillance and epidemiologic surveillance of physical activity and physical education is critical, because it not only allows us to understand the trends and what is the impact of implementation, but also because it allows us to see effectiveness and also to compare with other places and other examples. And tied to this surveillance efforts, this is like the rationale for the Global Observatory for Physical Activity and the Global Observatory for Physical Education. And this is why we started this global surveillance system. So we were able to track different we were able to track the progress in different indicators, such as surveillance, policy, and research. So we have been doing this with GoPA for 10 years, and GoPA started in 2023. And I invite you to look at our website, and just some good news is that in September we will launch the country profiles for at least 180 countries in the world in relation to these two key indicators and practices. So to finish, I just wanted to say that we do, even though we have a strong focus in global surveillance and comparing countries and identifying best practices and the best examples so we can inform this kind of work and local work, we do have some progress in local work and here in Texas. So we're running and we're going to start a new pilot, which is about, it's called the Impact Project. So it is to identify which are the policies that are here in Texas and in Houston, but also to gather evidence on implementation and evaluation and effectiveness, which is very scarce in the area of physical activity and physical education. So this is a project that I am running as principal investigator here, but I'm part of the Center for Health Equity and very grateful to be a part of it. So we will include a policy mapping scanning. We will do some consulting and validating of the evidence that we gather with policymakers, experts, and citizen stakeholders, and we will generate policy level recommendations based on what we find. Wes?
So you all should see a poll if you're interested. I ask you to just fill this out and we will follow up if you're interested. So are you all able to see the poll on your screens?
No.
Okay, give me 1 second.
So this, we know, and I know that this group has a strong interest in relation to policy. So I think this would be a really nice opportunity to work together to keep making progress in the physical activity working group for the health equity collective. So I will be more than happy to chat and interact with you in the short term future. I'm not going to answer the poll, but I will now allow, thank you so much. And I will now give the floor to my colleague Danilo so he can start also his presentation. Thank you.
Thank you, Andrea. Thank you all. Hi, everyone. Firstly, it's a pleasure to be here with you today. I'm Danilo Silva from the University of Sergipe in Brazil. I'm also glad to share what I've been learning so far through the Global Observatory for Physical Education. In the next few minutes, I will share preliminary finds from the Global Observatory for Physical Education, especially focus on how some countries are shaping their physical education policy and what we can learn for their approach. Next, please, Andrea. So while Andrea has already introduced the observatory, I would like to emphasize that this offers a global overview of countries with national policy mandating physical education at the primary and secondary levels. What we've seen so far is that most countries in Latin America, Europe, Asia, and Oceania has some form of national legislation requiring physical education in schools. In contrast, the United States follows a subnational approach, with states setting their own physical education requirements. This creates a great diversity in how physical education is delivered across the country. One important find is the lack of information for many African countries, which highlight the need for better data collection and policy transparency in that region. We also observed a global trend of decreasing mandatory physical education in later years of secondary education. In many cases, physical education is no longer compulsory for all grades, especially as students approach key academic transitional years. This is important question about equity and long-term commitment to physical activity in the educational system. Next, please. Even when physical education is mandatory, the time students spend in class can vary a lot. This map illustrates this. What we can notice is that even in countries where physical education is legally required, many do not have national legislation specifying a minimum number of hours. In some cases, responsibility is delegated to regional or local authorities. For instance, we can have the Australia has a national policy support physical education, but the minimum timing requirement are set as subnational level by individual states or territories, similar to the approach we take in the United States. That said, we observe that most of Europe, and many countries in Asia do maintain legislation, whether national or subnational, define minimum instruction time for physical education. This distinction is important because having a legal requirement for physical education is not the same as ensuring students receive adequate structured time for physical education. Next, please. So let's now begin looking at the few country-specific examples. Starting with Portugal. Portugal has a national physical education curriculum. Physical education is mandatory, and there is a minimum required amount of instructional time. So it check all the three core policy dimensions we have been observing globally. Please, next. But what really stands out in Portugal is the way the system monitors student physical fitness at national level. Though the Fit School, that is a program based on the fitness grant, Portugal collects constant data across the country. This allows monitoring of progress, comparison of performance by strength, age groups, gender, and identification of inequalities or areas that need more support. Next. Additionally, the Portuguese curriculum includes clear assessment criteria for key physical skills like balance or motor abilities. These national benchmarks are not only support evaluation, but also allow policymakers to understand how well the curriculum is being implemented on the ground. So Portugal offers us an example of country where policy, monitoring, and curriculum are well aligned, make it easier to ensure quality and equity in physical education. Next, please. Moving to Austria, we see another country with a national curriculum mandatory physical education and a minimum required instructional time. But Austria is now, next please. But Austria is now going beyond the traditional model through a major national pilot project called the Daily Physical Activity Unit. This is a joint initiative involving Minister of Education, Minister of Sport, regional government, and the sport umbrella organizations. This project is supported around three main pillars. The first one is promote a cultural shift toward movement and physical activity. The second, provide additional structured activity section each week. And the third one, offer a tailored support to meet individual needs. Next, please. During the pilot phase of this program, the program will reach a wide network of education institutions, delivering a substantial number of movement units and engage a large population of children of adolescents. These movement units include both the regular physical education lessons delivered by teacher and additional sessions delivered by movement coaches, especially trained professionals who support daily physical activity in schools. What's especially interesting in that initiative is being closely evaluated with data on implementation, participation, and stakeholder satisfaction. Even though some areas like stakeholder satisfaction still show room for improvement, this level of ongoing monitoring is an important step toward evidence-based scaling. This approach provides us an interesting reference, show how a national initiative can be implemented across a region, though coordinating partnership and sharing goals. Next, please. Now, let's turn to Spain, which offers a compelling case for countries with decentralized education system, much like the United States. This is another example of a country with a national curriculum, mandatory physical education, and a minimum required instruction time. Next. Spain has a national education law that defines overall structure of learning goals of physical education, include total number of hours per subject for a school year. However, the action implementation of weekly physical education time is managed by each autonomous community. This region have the power to adapt to expand the national requirements according to local priorities. One example is the Andalusia, one of the largest communities in Spain, where the physical education is delivered 3 hours per week from grades 1 to 7 and 2 hours per week from grades 8 to 10. This exceeds the national minimum and reflects how regional governments can take ownership and improve the reach of physical education within a broader legal framework. Spain's model shows that even in a fragmented system, strong national guidance combined with local adaptation can help sustain and expand access to physical education. Next, please. And finally, let's look at Brazil, a large and federally organized country with similarities to the United States in terms of political and administrative structure. Brazil has a national physical education curriculum. Physical education is mandatory across most of the basic education, particularly up to grade 9. A recent high school reform made physical education optional for secondary level, which has reduced its presence in many curricula. Additional, there is no national minimum time requirement for physical education over the week. Next, please. Despite this challenge, Brazil has made significant progress in developing monitoring systems that support evidence-based policy. One of such example is a 2019 bill proposing a minimum of 3 hours of physical education per week in general basic education. Although this bill has not yet been implemented, it was directly informed by the 2015 National School Health Survey, which revealed that over half of the Brazilian 9th grade students have only one or no physical education classes in the previous week. Next, please. Brazil also maintains a national database that tracks the presence of qualification level of physical education teacher, and this allows for ongoing monitoring of a crucial structural component of physical education policy, that is the teachers. However, despite having promising elements such as defined curriculum and monitoring mechanism, we do not yet observe strong implementation or impact at scale. This find point to a broader challenge. Having policy in place is not enough. Implementation and long-term sustainability is essential. And in Brazil, recent structural reform, for example, such as the high school curriculum change, have led to a loss of space and priority for physical education. This reinforces the importance of not only design strong policy, but also invest in their execution and protection over time. So to finish, what can you take away from these examples? Countries like Portugal and Austria show how a strong national framework combined with monitoring system can support consistency and quality. Spain and Brazil remind us that the centralized system success depends heavily on coordination, local adaptation, and political continuity. Across all cases, one lesson stands out. Policy alone is not enough. We need to focus on implementation, ensure equity, and protect physical education's role in the long term, especially in times of reform or shifting priorities. And this is exactly what we are still, where we still have a lot to learn and improve. In your case, by trying to put research also in service of policy. In next presentation, João will explore these issues in more depth. Thank you very much for your attention, and I'm happy to ask question and connect further after the section. Thank you.
Hello, everyone. It's a great pleasure to be here with you today. As we wrap up this session, we would like to take a moment to reflect on key challenges in this area and share some recommendations to move forward. Next, please. So, as Danilo was saying, one major challenge that we face is the gap that exists between policy and implementation in physical activity field and also in physical education. For example, globally, despite physical education being mandatory in certain school years, it's not always implemented as intended. For example, in primary education, early years, PE is often taught by generalist teachers who frequently lack training, resources, or confidence to effectively deliver physical education. Additionally, these teachers may prioritize other academic subjects as reading and maths over physical education, further impacting its quality and consistency of intervention. Next, please. So to effectively bridge this gap between policy and implementation, several key elements must be addressed. Beyond the essential financial, human resources, and as well as appropriate advocacy efforts, as Danilo was saying before, the GoPE and GoPE theoretical frameworks emphasize three interconnected and fundamental factors: policy, research, and surveillance. Policy serves as the foundation for structured and effective actions and programs. Surveillance ensures continuous, sustainable monitoring and evaluation of those policies. And research provides the evidence-based need to refine and improve strategies and to see if policies are being implemented and working. So by focusing on these elements, we aim to create a more cohesive and impactful approach to address these challenges in the field. Next, please. So let's go deep and take a closer look at some of these key elements of the policy. So schools are a vital setting for promoting physical activity and healthy lifestyles for all. It's the place where all adolescents and children have access to quality physical activity and physical education experiences. So in 2022, over 1.2 billion school-aged children were estimated to be in compulsory education. So the impact of these policies are huge. Schools, remember, are also the place where the majority of children and adolescents spend their waking hours. Importantly, and it's important to remember this, it's not only the minds, so the focus on academic performance, that the minds that go to school, it's the whole body, it's the whole children. So we need to have an approach that addresses all the components of the children and the adolescents. Importantly, why schools? I would like to highlight here the learning aspect. So encouraging lifelong physical activity is fundamentally a matter of education. It's behavior change. So teaching individuals to understand, to value, to develop the competencies, to have confidence, to be active for life is really important. So schools are connected with learning, with improving, with being better, with developing. So this focus on learning is very important. For that, next, please. And to ensure that all children and adolescents benefit from physical activity experiences, they must have access to quality physical education and diverse physical activity experiences within the school settings. As Andrea explained very well, this includes formal physical education classes, but also extracurricular physical activities, activities in recess, active breaks, active learning throughout the school day. So the provision of quality physical education identified in this report and its ongoing surveillance are essential strategic policy actions. So we need to go into this direction. Next, please. So in response to action, UNESCO in 2015 defined the quality physical education guidelines for policymakers, and they highlight the need for a planned, progressive, and inclusive learning experiences to promote active lifestyles and for children and adolescents. So despite the ongoing debates about the definition of quality physical education, the quality physical education agenda should shape policy and practice. This is definitely. So a key aspect involves, I would like to highlight this, establishing national frameworks within minimum benchmarks and essential enablers, including curriculum policies, resources, advocacy, monitoring, and research at the national and at the local level. In this document, you will also find several checklists to help you to evaluate the policies that are in place or the ones that you want to put in place. One critical aspect that is highlighted here and also in the physical activity field is how policies are written, how strong they are. They can vary from, for example, regulatory policy instruments and economic policy instruments or more soft instruments. So in physical activity field, the work from Gallius show that soft policy instruments are more applied to physical activity than hard instruments. In physical education, further work is needed. Next, please. So precisely, in USA, this systematic review that aimed to explore the effects of physical education policy on school environment and essential components of physical education showed that the policy research was predominantly descriptive and focused on minutes of physical activity or physical education classes. Importantly, the work recommends that further research is needed to determine if well-written policies and hard policies increase the learning outcomes. So this is really important to measure the impact in terms of the learning of the children, the number of literate individuals, and other downstream effects of policy. Andrea, next, please. That's why in GoPE, as Danilo showed, we focus in terms of policy in critical aspects, if physical education is mandatory or not, if there is a minimum and mandatory required time. So we are looking into the policy, how policies are written, and we will explore in the future the associated effects of how the policies are being written and implemented. Next, please. So the other aspect that is really important and should accompany policy is the surveillance. Next, please. Over the past decade, at the international level, formal initiatives have monitored physical education at national, regional, and global levels. However, most of these systems that you can see here are Europe-based or involve only a limited number of countries in certain regions. Studies primarily focus on time allocation for PE and PA in school, yet inconsistencies in these frameworks, data collection methods, and implementation cycles in their global efforts to benchmark, track progress, and inform decision-making for quality physical education. This table also shows that at the national level, only some of these systems focus on physical education surveillance, and few, very few, focus on the research. As you can see on the right side of the table, only one of these surveillance systems monitor the research that is being made about the policy. Next, please, Andrea. So in GoPE, also preliminary results show that and reveal a significant gap in physical education policy surveillance. Only about 20% of the countries reported having a national, formal, and external surveillance system to evaluate the implementation of physical education policies. So 80% of our countries did not report any national surveillance system of physical education, and we can understand the impact of this. Additionally, a key challenge for this field is identifying existing local, not national, local surveillance systems and determining how to transition from global monitoring to localized tracking of physical education policy. So this is also, next please, Andrea, some of the challenges that we face in this field. We need to have some instruments that, by the one hand, help us, our external team to evaluate the policy impact, but we should also develop instruments for the schools to self-evaluate themselves and to have data to reflect and improve action. So the European Physical Education Observatory was an international project that provided that for several European countries, and that helped to monitor from the national and go to local. At the local level, I would like to highlight here the school monitoring toolkit. It is composed by a questionnaire for the school coordinator, for all the PE teachers, and also the students. And this triangulation of data is really valuable to see what is being done from the different perspectives and what can be improved. Next, please. In the USA, there are already existing systems that actively monitor physical activity behavior across specific domains, and also physical education. There are established standards, as you may know, from the shape, and there are also some other fantastic instruments as the PECAT, a physical education curriculum evaluation tool that helps to see what is being implemented, and also has different levels from district into schools and to teachers and students in outcomes. Next, please, Andrea. Thank you. In Texas, Texas has also a great experience in physical education and physical activity in promotion, intervention, with a state law, for example, that requires annually assessment of students' physical fitness as fitness grams. Also, in terms of intervention, in GoPE, we are running an umbrella review, and 50% of the intervention studies come from US, and a lot of them come from Texas. So in terms of Texas, and our physical activity is being promoted inside schools in PE and all other components, you have also very, very good experience. Next, Andrea, please. So let's go to the last domain, the research. Next, please. And the research is clear. I would like that you could take this take-home message. So physical education, as you can see in this review, but also many other works, many impacts in terms of health and the development of the cognitive, the social skills, the emotional skills of all children and adolescents. So this is very, very clear nowadays. What we can see also is more physical education associated with quality physical education experiences. The time that is required is also associated with more physical activity in classes and also outside classes. Next, please. All the interventions that we were talking about that are being run in schools to increase physical activity show some positive but small effects of PE. All the interventions that aim to increase the moderate to vigorous physical activity during physical education classes, they have success. They can do tailored interventions, adapt the activities, make them more fun, meaningful, and this has these important results. But at the long term, we need more evidence. So we need to see the impact of these kind of interventions in the long term. We need follow-up studies, for example, longitudinal studies. Other key challenges that should be emphasized here: the need for more intervention research in Global South countries, where studies are still currently limited, and the necessity of analyzing the downstream effects of policy. So in Texas, with this bill, you have this fantastic opportunity to do policy research associated and have evidence-based to see the impacts of this policy. Next, please, Andrea. And next again. So we can wrap up here and make some key points to move forward in policy. We would like to highlight the need to advocate for sustained financial commitments that support policy development, emphasize multi-sectoral collaborations, for example, between different organizations from education, from sport, from health. They can work together to put their practices in place. In terms of surveillance, leverage the surveillance data. We need to have surveillance to see the impact of the policies and to increase future in policies. Sorry. In terms of research, stimulate national and local research initiatives. And finally, in terms of implementation, remember, there is a gap between policy and implementation. We need to increase the implementations of the policies that are being designed, support, and make them have the impact. So this focus, we need to eliminate this gap between policy and implementation and develop a common agenda, apply aligned monitoring systems, coordinate efforts could help to overcome this gap that we identified here. So to finalize, thank you very much. I would like to thank you very much for all the GoPA and GoPE community. We are here also due to their effort. And thank you very much to all for your attention. We are open to all your questions. Thank you.
Thank you all. Feel free to either type your question or raise your hand. And while we're doing that, I think it'd be fun. We have an international crowd, so there's an optional poll we have here about where you're from. Go ahead and fill it out. Question I have is, can you think of a nation? I know one of the points that resonated is, of course, policy is a step, but it's not enough. Is there any anecdote with the country or region where you all were able to follow up with the implementation or use the research? to help move the ball forward, so to speak.
Yeah, there are some and João and Danilo can comment on this, but there are some examples of countries that were able to really track implementation of the policy and then evaluate it. So Ireland is a great example, and Ireland is great example because the academics and like the national policy was developed and it started in academia. And then they were able very successfully to bring together all the stakeholders, and then they created the policy. It was adopted, implemented, and now they're running evaluation cycles with really good results. The impact project that I talked to you about is the principal investigator is Catherine Woods from Ireland, and this project is being piloted in 6 countries in Europe to precisely identify implementation evidence and inform with a co-design approach the key actors in these countries. So that is one example that is very successful. Another example of how physical activity was integrated as part of the policies is Slovenia, also in Europe. They have a very strong evidence on integrating physical activity prescription in the healthcare system. So they have really good results when it comes down to tie it up to health outcomes. João, do you have any? I know Portugal has some good evidence, and Danilo can comment too.
Yeah, the one that Danilo talked about, the physical fitness, I would like to say in our curriculum of physical education, there are 3 main areas: the physical activities, the knowledge, and the physical fitness. So the physical fitness is something that all the teachers need to work, improve the students, and collect data on. This data is going to the Fit Scholar platform, a national platform, and all the teachers are supposed to provide those data, anonymized data, and we can track in real time what is the status of the nation. So if there are more kids in the healthy zone, in the strength test or the flexibility test, and this is something that is really coordinated between the government, the Department of Education, the Faculty of Human Kinetics, and also the teachers. We run, for example, the training of the teachers across all country to be able to implement this policy. This is one example. And I would also like to talk a little bit about Hungary, because this is a country that requested physical education lessons to exist in every day. So daily physical education need to be in school. And I don't know how we look for it about the impact of this policy, but I know some of the difficulties were there were not enough human resources, teachers, qualified teachers, to implement daily physical education to all students in schools. So that's one thing that I would like to bring you here.
Just to add a small thing, I think it's very interesting, this type of evaluation about the implementation of a policy, because, for example, we have a good example in some countries, some small countries, that can try to link, to connect some of also not only objective, but also qualitative assessment of the implementation. So I think one challenge would be to try to connect what can we coordinate local and small scale evaluation, especially also listening to stakeholders and trying to include also qualitative assessment, and in general link all this local experience to provide a broader evaluation of the implementation. That is the case of our countries like Brazil or like US. That's the dimension is different. Yeah.
I have a question. Thank you so much, Dr. Martins, Dr. Varela, Dr. Silva. Fantastic presentation, and really appreciate how you guys presented some of this complex policy conversation in a very simple way. I have one question for Dr. Varela. Can you share a little bit more in regards to the specifics of the work that you're proposing to start here, and how do you see it perhaps dovetailing with the work of the Health Equity Collective? I saw the poll question around a physical activity work group, but I think that might help sort of get the juices flowing in regards to what we want to do together.
Thank you, Srila. Yes, absolutely. So the Impact project, it started in Ireland, as I mentioned, and it comes from a tool to have a tool that was developed to have like a policy inventory. So this tool wants to understand through data collection with different key actors, like what are the policies that are existing and what is the evidence of implementation. So for physical activity and for physical education, there is a big gap in terms of which are the instruments that really give you an idea of the implementation degree and how to assess it. There are different indicators, but there is no global standardized instrument that we could use to assess that. So the idea is to pilot test this instrument, which was developed based on evidence. So it has a really strong base on scientific evidence of what are the key actions and the best practices to promote physical activity. And obviously physical education is included there. But also this project that is being piloted right now in 6 countries in Europe has a really interesting approach, and it has like the co-design and co-development approach that engages civil society and key actors in the place where it is being piloted. So I want to test it here in Texas. In Europe, it's been in countries, but European countries are smaller, and Texas takes it can be like 5 countries in Europe at the same time. So that's why I think it's a good model for us to understand not only which are the policies and what is kind of the set of policies, because we know here in the US, laws are very important. And as João was mentioning, laws are hard instruments compared to guidelines and other instruments that are being used in other places to promote physical activity. So I think it's really interesting to see it from that point of view, but also to be able to really, I think the project will grow very much just because of the setting of the Health Equity Collective, and because you have done a great job, which is translating evidence to real world practice. And really, the Health Equity Collective has understood very well the importance of bringing together all the key actors, and not only being focused on research or theory. So I think that's why Texas, because of its diversity and the population diversity, I think it's a really good place to start a pilot of this impact tool, because it's also it can also inform one of the key goals of the Global Observatory for Physical Activity, which is to replicate this in other countries in Latin America and to scale it up to other countries in the world. This is what we have been doing in relation to the policy work for the last 10 years. So we developed a policy inventory that can be used in all the countries in the world, and we are now trying to understand the connection between different levels, going from national, subnational, and local levels, between different actors in policy making. So I think it's a great opportunity to work together, and ultimately we can understand benchmarking of policies and which are the key actors in each of the settings. Yeah, that's part of what the project wants to do, and I would be more than happy and privileged to work with you in this.
Okay, our next question comes from Larissa and says, can what you shared today inform the policy priorities we share through statewide groups? And she's included the link. Larissa, I don't know if you want to explain it more.
Yes, I just, I think locally there are some opportunities at the state level. And of course, some of these opportunities have been things we've not seen get passed in the past, such as protecting recess time. But, I didn't know if some of the work that you'll do in the future could help us to decide, which policies we feel are viable at state level, local level, just because I think it's so particular to where you live, and what's possible. I also think that, and I'm sorry if I missed this, but I know there are some experts that are working on child mortality as it relates to traffic patterns near schools, which make it nearly impossible to have safe routes to schools. Those are pretty big equity issues that I think some local experts are working on. So I just didn't know if there's going to be emphasis on that could, because I think sometimes you can't do it all. But I do believe in intervening through the schools. I just think sometimes you have to be a little strategic about where you put your time. And so I didn't know if your future work was going to help us to kind of see things a little more clearly for what's viable.
João, do you want to comment on that? Thank you, Larissa.
Thank you.
We talking about the GoPE right now, we are focusing on the national policies. So we start there. I think in the future, we will go from national to local. But right now, we are starting with the national level. But for those countries that are not ruled at the national level and go to subnational level, we are asking our specialists to provide good practices, examples of states and something that's going there that there is evidence that works. So when we launch the GoPE cards, we will learn a lot with these examples, for sure. But
Thank you.
From my perspective, I would also like to say physical education, as WHO and CDC also highlight in their documents, is the heart of intervening in school for promoting physical activity, because in terms of equity is where all they are. And it's supposed to be eclectic, inclusive, diversified, and where they can develop different skills. I can promote a walking program, but this is not going to help them to swim, to have balance, etc., etc. So in terms of equity, physical education, I would like to highlight is essential because it's mandatory in many countries, in many states, and it's where all children are supposed to be and learn.
Thank you.
Well,
Larissa,
I-
another thing I wanted to complement real quick is that in GoPA, on GoPA, we developed a policy directory. So we're gathering lessons learned and best practices from all over the world. So some of these settings are, well, Texas is similar to some settings in other places. And because we have a structure that is based on country contacts and country representatives at the local level, maybe in the future, I see us trying to understand a little bit the impact and gathering additional evidence to understand what's going on at the local level. But this is a work in progress, and I think there's a lot of opportunity to collaborate and think about what are the priorities and how GoPA and GoPE can actually help inform decision making and try to highlight gaps and opportunities.
Thank you. That makes sense.
Yeah, this has been a great conversation, but it is the end of the hour. So there were a couple of questions in the chat. What I might do, if you all are able to, the three speakers, is I can send you those questions and then we can respond on the group email so you all have an answer to those. But yes, thank you everyone for attending. Thank you again to our three presenters, and I hope you all have a good Thursday.
Thank you so much.
Bye.
Thank you.
Thank you so
Great to
much.
be here.
Thank you.